what advice would you give employers and like big ones and small ones? What do they need to do?
Um, I think all the work that we do within working with cancer, one of the big things is about the company culture and whether it's safe to speak up.
Yeah.
And so, for example, like I said earlier, if you're become, your husband or partner or someone is newly diagnosed and you're their primary caregiver, and the advice is to tell your manager. In some organizations, people don't feel safe doing that.
No.
So I think the first thing is for an organization, you have to create a safe space, a culture where people can disclose things and don't feel that their job is at risk or they're going to be penalized or something. So that's the first thing. Not an easy thing to do, and
Mm.
it takes years, but I'd say that was the first thing. I think the second one is to offer real flexibility, not let it just be something that you put on policies, but in reality, yeah, we say we do give offer workplace flexibility, but in essence, it's sort of frowned upon,
Mm.
and because then people are afraid to ask for it. So I think offer real flexibility. I mean, I know it goes without saying, but I think managers need to be trained. Line managers need to understand, and it doesn't have to be just about cancer, but understand it because as you said earlier, I mean, there are so many unpaid carers in this country, not just with cancer, but across all
Mm.
illnesses and diseases and things that they have to help. And I think a lot of line managers have no idea what it means to be a carer, whether if it's something for a relatively short-term condition or if you're dealing with somebody who has long-term health conditions. So I think line manager training and awareness of the caregiver load would help. Um, and in that is that understanding that, and if you're a carer and you're having these conversations, your performance is going to fluctuate. So a manager needs to understand that there will be fluctuations in performance because you're not going to be on the ball because it's like you've got a second job, unfortunately unpaid. Um, and also understanding that the workload or your caregiver responsibilities are very unpredictable, out
Mm.
of your hand. The hospital calls and your loved one has to do a PET scan. They've got an opening this afternoon at 2 o'clock. It's 10 o'clock in the morning. Can you be here for 2 o'clock?
Yeah.
Yeah, yeah. And the answer is yes. And you have to drop everything. And so at work, in a working environment, you're saying, "What do you mean you're disappearing?" So I'm sorry, I've got to go. I've got to take my loved one to hospital or whatever. Um, and and I think the other thing is that you're not looking for special treatment. Because I think this is where, in the British culture as well, sort of the guilt about letting people down or whatever. You're not looking for special treatment. You're just looking for understanding. So I think employers need to understand that you're being an empathetic employer,
Yeah.
not sort of treating people as favorites.
Yeah. I think that it's managing uncertainty is so difficult, but it's important that you kind of put employers on, on notice that there are going
Yeah,
to be periods of uncertainty,
yeah,
and it's tough for everybody, the carer in particular, but the employer has to understand that you're not planning on just disappearing at a moment's notice. It's what you have to do occasionally,
yeah,
things have to slip. And if they have to bring in cover
yeah.
occasionally to help out, then that's what they need to do.
Yeah. And one of the biggest risks, and especially with my husband's condition, but across is the risk of infection, and
Yeah.
because the immune system
Yes.
is compromised, and like my husband, he had 3 bouts of sepsis, and sepsis is a life-threatening condition, and it changes so quickly, and it, and I think it's one of those things that if you don't understand that you need to act very quickly and promptly as a caregiver and be aware of the signs and
Mm.
advocate that, it's one of those things. It adds the unpredictability of the disease because
Mm.
infection control is probably one of the biggest things that you need to be aware of.
Yeah.
And actually linked to that is also infection control is that you may need to work from home, especially when things are acute, because you don't want to travel on the train
No.
and go into work because you want to try and keep your home environment as germ-free as possible. And we had a situation where we wouldn't allow younger members or people who go to school. And even my son was at university at one point. He had to come home and he used to have to wear a mask. And we had like the COVID protocols.
I say like
at
COVID.
Home. Yeah. Because, and so, you know, that you have to restrict this. And this, so if you're a regular commuter, and, you know, the expectation that you'd have to go into the office, you know, that, especially when things are acute, you're not going to be able to do that. You know, so that working from home, not just for workplace flexibility, because you're trying to reduce infection and minimize those as well.
But I think all of this is just reinforcing the fact to keep in really close touch with your employer, doesn't it?
Absolutely.
So they know exactly what's happening and what you can or can't do.